This pharmaceutical wholesaler currently has 130,000 different medications stored in its warehouses. It supplies pharmacies across Germany. But what about the future?
The main concern is that many pharmaceutical products and active ingredients are produced in Asia. What that means is becoming clear right now, during the current pandemic. Germany only produces a few products of its own. It's the same throughout Europe. Right now, production standstill in China means that a number of active ingredients are not being produced.
He reckons the shortages could be felt in Germany within a few months.
This is a disadvantage of globalization. Globalization has many benefits, but this is a classic drawback. When you have different kinds of governments with different interests, then it's possible that a country could find itself in a position of power and not use the power sensibly. It's one of the political risks of globalization.
Germany gets most of its medications from India and China, including antibiotics. 90% of the critical ingredients for all antibiotics worldwide now come from these two countries. Indian pharmaceutical companies, like here in Kala Amb in the north of the country, have become important players in the production of generic medications. The low labour costs here mean they can produce inexpensive drugs. But most firms, including Sci-Tech Medicare, rely heavily on supplies from China for their production.
If China stops exporting key ingredients to India, 80 to 90% of India's pharma companies will close down and patients will die.
Totally depend on China.
India sources most of the active ingredients for its products from China because production costs are lower there. In fact, most of the active substances found in medicines used around the world come from mega factories in northern China. How have we reached such extreme dependency, especially with something as essential as medications?
Most importantly, we've had discount agreements for at least the last 10 or even 13 years. That means that health insurance companies sign contracts with producers in which they agree prices. The result has been far lower prices. Health insurers have been patting themselves on the back for this for years. However, it's becoming obvious that goods are no longer being supplied to Germany in sufficient quantities.
The halt in production resulting from the coronavirus pandemic means that fewer active pharmaceutical ingredients are being sent to India. As a result, India has curbed its own exports of 26 different drugs, including some antibiotics. The government in Delhi wants to ensure that it has sufficient supplies of such medicines for the Indian population. That could soon lead to fewer supplies being exported to Germany. The pressure is growing for Germany to become more self-sufficient.
The politicians have started to realize that too. But because we've grown used to low prices, I can't yet imagine how we'll be able to produce medications here again without having to pay through the nose for them.
It would take years to get European production running on full capacity again. And doing so would mean a sharp hike in drug prices.